Welcome to another edition of the Leadership Series, sponsored by Lympha Press. We are shining a spotlight on people that are making an impact in the worlds of lymphedema, lipedema, chronic venous insufficiency, and wounds. And we're honored to have one of my favorite people, and she is a certified lymphedema therapist who genuinely cares for patients and is making an impact. Lisa Sylvestri, it's so nice to have you here.
Thank you. It's so great to be here. It's wonderful to see you. I'm just excited to be here again.
Well, me too. You did a wonderful webinar with us not that long ago, but this interview is all about getting to know you as a person. So tell us your background.
You know, a little bit about me. I have been a physical therapist for, I'm in my 23rd year now. And I think that, I found my passion little less than halfway into my career for working with patients with lymphedema and patients with cancer. And I've been in California for 10 years. And my personal and professional trajectory, I feel like, has all brought me to where I am right now as the owner of Oasis PT and Wellness, as someone who is, just excited about the future of the industry and the future of entrepreneurism. And, I'm just thrilled at where everything has sort of brought me to here.
So you can see that you're happy about it. It just shines through when you're talking. But you said you found your passion about 10 years in. How did you find your passion?
So I was working as a PT in the outpatient orthopedic realm down in South Florida, where I'm from. And, it was right when Medicare was first starting to make some changes. And I truly was just getting burnt out with the patient population I was seeing. And a family friend of mine, who unfortunately is no longer with us, but was talking about her breast cancer journey. And she started talking to me about this side effect she had called lymphedema. And I said, "What's that?" I really had no idea that this even existed, that this was a disease state. And so she gave me, the 5-minute version. And she said, "But Lisa, the thing is, it just feels so good." And I said, "When was the last time anyone ever said that feels good? When did my patients really appreciate the work I was doing?" That led me to get my first certification, and, the whole future of my career and life changed. And, it really was all for the better. And I'm just thrilled with where I'm at. This far into your career, you can always, find that passion. You can always change. You can always mix things up a little bit. But I didn't know when I first started that this is where I would be.
I find it so interesting that most of the people I'm interviewing in this leadership series have that personal connection that led to an aha moment. And I feel like that's where you find your calling, where something touches your heart deeply. And next thing you know, you can't help but follow that heart.
Uh-huh. And I think those of us who are in this profession, you have to love it. You have to have that passion, because it's hard, because it's hard working with patients with a chronic disease, whether it's lymphedema, whether it's cancer. It's tough, because you never want to be the person to say, "This isn't going to go away," because we can manage it. We can make the patient feel a lot better. We can help them deal with it on a day-to-day basis. When it comes to cancer, hopefully a patient goes into remission and there's no evidence of disease, but they're never without fear. They're never without worry. So if you don't have the passion to work with this patient population, it's going to be hard. I mean, just this week, a patient of mine didn't show up. I made a few calls, sent a few texts, and I got the very upsetting text back from the daughter that, unfortunately, the patient wasn't doing well and wouldn't be returning to therapy. And 23 years in, it still breaks my heart to get these messages. And I'm human. And I think caring about my patients makes me good at what I do, but it's also the hardest part about being a therapist in this industry.
So someone that chooses not to come back, is it because their condition Is it a mental thing where they've just given up? Or
Oh
is it
no, this patient unfortunately is the their condition has significantly declined since I
so
last saw them
sorry.
a week ago, and unfortunately is not expected to make it.
I'm
So
so
it's
sorry.
yeah, it's hard. And just 2 weeks ago, we were thinking about next steps and talking about, plans, and we were making improvements. And, this isn't my first call, and
No.
it's hard. But,
Yeah.
on the flip side, I know that this happens, and I know that this is something that I have to deal with. And, I know I've made a positive impact up until now, so I have to feel good with that.
So I am going to flip the order of the questions just because I want to hear a success story right now.
Yeah. Yeah.
Just even for the people watching too, because I know that yes, this is a chronic condition and sometimes you don't have the outcome you hope for, but then there are times when everything you've done has made such a difference and it lightens your own heart and keeps you motivated to keep going. So I want to hear that story.
Yeah. And I mean, I have a lot of those, which is the good news. I have a lot of patients who just didn't understand how to manage this condition, and they start to feel significantly better with treatment, and they learn what they can do on their own to make themselves feel better. So I have lots of patients where the success is just getting the arm up overhead so that they can get into radiation. Another success is going down a size in compression garments. I think that there are way more successes, thankfully, in my business than failures, and hard days. But comes full circle. And I think right now, truly, my biggest success is that I'm starting year 3 in my private practice. So Oasis is turning 3 in April. And
Congratulations.
thank you. We've seen a lot of growth this past year, and understanding how to run a business. I tell you, that is a huge success because it is hard, and it is difficult, and it is a roller coaster full of ups and downs, and learning how to navigate what I'm doing, how to do it, how to best manage the patient when we're dealing with insurance, and how to make sure the patient understands that even without insurance, or if benefits have expired, you can still continue to come see me. And my goal is that I am there for the patient from day 1 of diagnosis till the end, whatever that end may be. Because this is not just, well, I am your physical therapist for the next 2 months. I am part of your care team moving forward, and how to create that and keep myself happy, my patients happy, and my business happy. That's my greatest success today.
I think it's a wonderful journey that you've been on and the creation of Oasis. I mean, the name itself, does that speak to your core values? And let's talk about your core values.
Yeah, my core values are very much making sure that I am seeing everyone for what they need, not today, not tomorrow, but for the next year and 5 years. My core values are that every cancer patient is able to live their best life with the highest quality of life possible. And that's different for every person. And I really want to help bridge that gap, because I think there are a lot of gaps in cancer care and in lymphedema care. And, I'm very lucky that I work closely with a lot of oncology offices. And now in the Bay Area, there's a lot of lymphedema surgeons, which is, as a whole new, part of this treatment puzzle and treatment continuum. And I really think that it's important to be able to offer the support day in and day out.
Living your best life. What a great core value and what a great thing to be a part of. We at Lympha Press love being a part of the patient's care team because whether they've taken a surgical intervention, whether they are, and hopefully, usually going to see a therapist, but then we come in with the pneumatic compression at home to continue the hard work that you've done hands-on. So it really is teamwork that makes and helps these patients live their best life. So I love that you said that. So we have
Absolutely.
two audiences for this interview, Lisa. One is patients, one clinicians. What should patients know? Maybe they just got a lymphedema diagnosis. Maybe they got a cancer diagnosis and they're starting to notice some swelling. What would you say to them?
Get to your doctor, talk about it, and find a certified lymphedema therapist in your area. Because if you are a patient and hopefully before you start having some symptoms, you're at least aware about this condition, aware of help being available. We live in a day and age where we can help you through technology if you live in an area where you're not close to a therapist. There are so many amazing ways that you can be helped at the earliest sign of pain, swelling, dysfunction. Talk to your team and search for it because we are out there. And just make sure that you don't ever take no for an answer. The patient needs to know that they are their best advocate and that they need to keep on pushing until, they get answers. May not always be the answer they're looking for or they want, but there are always going to be people with answers and people who can help.
And don't push away the question. Sometimes we
Absolutely.
talk ourselves out of pursuing something because we dismiss it. We're just like, oh, that's nothing. But in the case of lymphedema, edema, swelling, it's so important to address it quickly and soon after it begins to present.
Absolutely. I always tell my patients that they are their own best advocate and that they need to go into their meetings with a pen and paper or, ask your doctor if you can record it on your phone because nobody can remember these things in the heat of the moment anymore. But absolutely, if something doesn't feel right, it's not. Period. End of story. And advocate.
That's so well said. If it doesn't feel right, it's not. Excellent advice. I love that. So now a takeaway for clinicians watching. You are part of our Lympha League. You
Yes.
were one of the stars of the Lympha Press 2023 calendar, and we had an amazing ensemble of some of the leaders in the worlds of lymphedema and lipedema in our portrayal of superheroes. Would your message to clinicians include this collaborative spirit?
Absolutely. I mean, I think my message to clinicians is also very similar. This is hard. Doing what you think is right is easy. Treating the patients after you have enough experience, that's easy. It's the business, it's the collaboration that you really have to work at. I'm thrilled to actually tell you here, I've just created an online course for lymphedema therapists, PTs, OTs, massage therapists who are looking to start a private practice. It's kind of like a step-by-step guide on the things you need to know. I'm certainly not the expert in all of these areas, but like I said, 3 years in, I found the right people to talk to. I've kind of put everything together in an easy to find format. And I really think that it's hard, but you really have to understand how to run a business. Because if you don't have the passion for business, it's going to be even tougher.
How do people find out about this? This is really amazing. And really what you have learned over the course of the last few years, you now said, let me help make it easier for other people who want to serve patients like I do.
Absolutely. So on my website, www.oasisptwellness.com, and also on my Instagram social media, which is also Oasis PT Wellness. Oasis PT and Wellness with underscores in between. There are links to the class. I think that there are so many different groups where everybody is open with information and we all help each other, but really being able to create this step-by-step guide. Eventually, I'm hoping to create a think tank with some of the other wonderful people in the Lympha League where we can help each other, overcome some of the hurdles that are running a business, because it's not just about how we treat our patients. That's, like I said, the easy part, but doing it while you're running a business. I have a 5-year-old who demands a ton of time. I have a leak in my office right now. I mean, these are the things that you just don't think about because you're going into it because you love patient care. Clinicians, absolutely, everyone can do this. I started my business because I wanted to create that oasis. I wanted to do things that I was not able to do in a large hospital system. I wanted to be able to follow the patient from day one to day forever and use some different tools that I couldn't get my hands on otherwise. And just really excited about all the wonderful things that a lot of clinicians are doing to help each other now. And I want to jump in the game.
Well, you certainly are and have, and I'm thrilled that we get to help promote this on our platform here at Lympha Press as well. So you've made big strides. What else remains on your wish list?
Well, there's still certainly a wish list. My goal is to be the leader of oncology and lymphedema care in the East Bay, which is where I am, and then continue to create this design, whether it's Oasis or working with patients and therapists all over the country, where they really can get this full circle comprehensive treatment. I think that unfortunately, I still get patients who come to me and say, my doctor never told me that therapy was an option. I live in the San Francisco Bay Area. I'm not in a difficult place to find treatment. Raising awareness for the patient, raising awareness for the clinician that there's still a lot we can do no matter where you are or who you are. And, continuing to elevate the game for treatment for everybody. That's my big way out there goal.
One of the gratifying things about doing this series is everyone I talk to, I feel like I'm levitating a little bit because there's so much power and energy headed in a positive direction. I've talked to people that were involved in lymphedema care over 20 years ago, and the strides that have been made, it is thrilling and wonderful. And there's such forward momentum. So we are running out of time. Is there one takeaway that you want to leave with our audience?
I think the one takeaway is go for it if you're trying to start a business. If you're a patient, it's ask for it. So making sure that you are doing everything you can with the most amount of information you can, and work hard, because if you're a patient managing lymphedema and cancer care, it's hard. If you're a clinician starting a business, it's hard, but going for it and asking for it, those are the two main things.
Two great takeaways. What a great interview. Always lovely to see you. I appreciate the work you do so much and appreciate working. Lympha Press appreciates working with you as well. And thank you for tuning in to this edition of the Leadership Series. If you know someone who deserves the spotlight, like Lisa Sylvestri, please reach out to me, bviola@lymphapress.com, and we'll schedule an interview. This is thrilling and wonderful. Thank you, Lisa. Have a great day.
Thank you, Brenda, very much for having me. Thank you, Lympha Press, and you have a great day as well.
Bye-bye, everyone.